Hi, I'm Dr. Jeremy Bartz, and in this video I'm going to be talking about sleep. Sleep is probably the most underestimated health variable there is. Studies have shown that sleep affects almost every aspect of our health. We know that it has a huge impact on metabolism, which can lead to weight gain. It affects cognitive functioning, our mood. We've all heard the saying, that guy woke up on the wrong side of the bed. Sensitivity to pain is impacted by how well we slept. Aging, our immune systems, tissue repair, including muscle growth. This is part of the reason why bodybuilders spend so much time and focus on making sure they get really good quality sleep, because that's where most of our muscle regeneration takes place. And last but not least, it affects our energy levels, which in turn has a big impact on productivity. Now, those are just a few of the different health factors that are impacted by sleep. So I could go on and on about the importance of sleep forever, but in this video we want to talk about how to improve sleep. When we talk about improving sleep, the first thing that you need to understand is that sleep actually comes quite naturally when all of the barriers to good sleep have been removed. When you think about babies, they don't need to be taught how to sleep. They don't need treatment for insomnia. It just happens automatically because we're all wired to sleep automatically. But the only time sleep becomes a problem is when certain barriers arise that get in the way of us getting a good night's sleep. So when we talk about improving sleep, what we're really talking about is removing the barriers and obstacles to good sleep. And in this video, I'm going to be talking about two different types of barriers. The first are environmental barriers, and the second are associative barriers. Now, environmental barriers include all of those factors that can make up our sleep environment. So things like the mattress, the amount of light that's in your bedroom or the amount of light that's coming into the bedroom, the temperature of your body while you're in bed, noises that are in the room or noises that are coming into the room from outside, just to name a few. There's obviously many others. These may seem like obvious things that most people would automatically address when they're trying to get a good night's sleep, but you'd be surprised at how often we overlook these things just because, they're habitual. Many times I'm working with patients and they'll tell me, oh yeah, my room is completely quiet. I don't have any noises. But then as we continue talking about their home and their evening, they reveal to me that they have a chihuahua in the living room that's barking and they can hear it. So obviously that's going to have an impact on their sleep. They were just so used to it, they weren't thinking anything of it. Other things that might come up is somebody might have really thin curtains and there's a street light right outside their bedroom window and there's a bunch of light flooding into the room. So we want to make sure that we do a thorough assessment of all the different environmental factors that might be interfering with your ability to sleep and sleep deeply. And once we've figured out what those are, they need to be addressed in creative ways. Some of those creative ways we address that could be as simple as getting a high quality pair of earplugs. Or it may be something a little bit more complex, like getting an adjustable bed frame, and this tends to really help with things like sleep apnea. So whatever it is, the environmental barriers to good sleep need to be addressed. The second type of barriers that I want to talk about today are associative barriers. Now, associative barriers are any barriers that are due to the effects of classical conditioning. And if you're wondering what classical conditioning is, think back on if you took an intro to psychology course, and you may remember that they talked about Pavlov's dogs. Pavlov was doing some experiments on dogs, right? And he had a bell that would go off to remind him to feed the dogs. But one day he ran out of dog food. Since the bell was on a timer, it just continued to go off regardless of whether or not he had dog food. And he noticed that every time the bell would ring, he'd look over and the dogs would be there panting and salivating profusely. Now, Pavlov found that interesting because he knew that the only reason a dog should be salivating is if they're presented with food, because it helps with the digestion process. But here they were salivating away and there's no dog food present. So being the smart guy that he was, he made the connection that the association that the dogs had made between that bell and food was enough to provoke the physiological reaction of salivation all by itself. And he called that classical conditioning. He also tested this on humans and found that the same thing happens with us. And since then, we've discovered that the principle of classical conditioning has a huge impact on sleep quality. And this is how it applies to sleep. I usually tell people, think of my hand, the palm of my hand, as your bed. Okay, so this is your bed, and these are the things that you have associated with your bed. My fingers represent the things you've associated. So the only thing we want associated with your bed is good quality sleep. That's my thumb. This might be watching TV in bed. This might be playing on your cell phone. This finger represents reading in bed. And this pinky finger might represent tossing and turning in bed. So in an ideal world, we would only have this associated with your bed, good quality sleep. But because we're imperfect, we oftentimes do other things in bed and we make all of these other associations. What happens is when you're presented with your bed, when you lay down in bed at night, all of these different associations get activated. And they're all competing for your attention. Your body and your mind are confused. They don't know what to do. One part of your body thinks, I should be sleeping here. Another part thinks that you should be entertained. Another part thinks you should be playing on your cell phone, or you should be, reading a book. Or perhaps maybe you should be tossing and turning and just worrying about all the things that you have going on in your life. So we don't want that going on. We want to eliminate all of these non-sleep associations. Now, the first three are relatively easy to get rid of. All we have to do is just watch TV in a different room, or leave your cell phone on the other side of the bedroom, or read the book on the couch instead of in the bed. This last one, tossing and turning, that's a little trickier, and it's too involved to go into in this video, but if you work with a good therapist who does some work with cognitive behavioral therapy for insomnia, they can go into more depth about how to apply address this one. The way we address it is using something called the 15-minute rule. And a good therapist will help you to apply the 15-minute rule to your specific situation. When I work with patients on the 15-minute rule, I usually combine it with some form of relaxation training, whether that be mindfulness-based stress reduction, biofeedback, I usually use heart math breathing, or perhaps hypnosis. And we use the type of relaxation training that tends to work best for that particular individual. That's a really important point. As you improve your sleep, you want to pay really close attention to what works best for you, because what works for me may not work for you, and what works for your neighbor may not work for you. So you want to pay really close attention to what works best for you, and as you hone in on those things, you'll be able to really successfully remove the different barriers that are getting in the way of a good night's sleep. So in summary, when we talk about improving sleep, we want to first remove any environmental barriers that have been interfering with your ability to sleep. Second, we want to address break any negative associations that you've made with your bed, so that you can really strengthen up that one association of sleep, good quality sleep with your bed. And if you do this thoroughly and consistently, you should see some pretty significant improvements in both your sleep length and your sleep quality. And as those improve, you can see the other health variables that go with sleep improve as well. So again, this is Jeremy Bartz, and sweet dreams.